Hello, I am Dr. Pinky, and welcome to video 3. Have you noticed I've got closer? That's because my silly cameraman just found a new button. He is not very clever, but you will be very clever once you have watched this video on alcohol assessment. This video is again designed to give you an introduction to the topic of alcohol problems as medical students. But remember, it's just an introduction. You will need further study to cement your learning.
In clinical practice, you need to be able to take focused alcohol histories from patients. So let's find out how to do it.
I am going to talk you through the main points of an alcohol history. The first thing to establish, after you have checked the patient's identity and gained consent, is to find out how much they drink. Establish if the patient is drinking every day. People's habits vary, so ask about normal days. Establish the patient's pattern of drinking. You need to have an idea of how many units the patient is drinking. To do this, ask about how much, what the percentage is and what they are drinking. With beer, find out about strength and if they drink pints or bottles. With wines and spirits, it can help to ask about the size of the glasses and how many glasses they get out of a bottle. This makes it easier to work out their unit intake. Next, find out how long the patient has been drinking that amount for. Just like in smoking, you must consider the amount and the time to know how serious the drinking is.
Once you know how much the patient is drinking and how long they have been drinking it for, you can ask the CAGE questions. These are questions used to screen for alcohol problems. The letter C is for cutting down. Have you ever felt you should cut down your drinking?
The letter A is for annoyance. Does it annoy you when people challenge you about your drinking?
The letter G is for guilty. Do you ever feel guilty about the amount you drink?
And finally, E is for eye-opener. Have you ever needed a drink first thing in the morning as an eye-opener?
Patients who reply yes to one or more of the CAGE questions should be questioned further. And remember, patients who answer no to all the CAGE questions might still have alcohol problems.
So now go on to ask about the 7 signs of alcohol dependency.
The first is, do you have to drink more than you used to get the same effect when you drink?
The second is, do you get withdrawal symptoms if you do not drink? Ask about the sort of symptoms. Do they go away if the patient drinks again?
The third is, do you find drinking takes priority over other activities?
The fourth is, have you tried to quit? Did you start drinking again after you quit?
Next is, do you ever crave drinking or have a compulsion to drink? Do you put time and effort into getting drinks?
Sixth is, does the patient have a reduced social repertoire due to drinking? Lastly, does the patient continue to drink, even though the drinking is causing them problems with their physical or mental health?
These 7 signs of alcohol dependency should be investigated in a proper focused alcohol history.
Finally, you should check out the consequences of their drinking. Drinking can affect patients biologically, psychologically, and socially. You should look up these effects so you have a good idea of what to consider. Good. Can you remember all the questions? If you know them all, you're doing well. I can tell you are getting smarter. Check out my other videos on resources and get even smarter. Goodbye.
See you next time.